are much higher than they really should be. We need to govern the way that our private insurance company helps us finance healthcare because they do a job for us, but we definitely need to address the financing issue. Thank you.
Thank you. Charles Djou.
Thank you, Wayne, for that question. You know, Wayne, any of us who get elected to the United States Congress, the most important thing we're going to do is cast a vote. I know there's lots of complex issues we can talk about over and over and over again. But you began your question by asking us, there is a healthcare vote coming up in the United States House of Representatives, possibly as soon as this week. I think your listeners want to know, how would we vote on this? You asked a straight question, you deserve a straight answer. My position is that I would not vote in favor of the current reconciliation bill in front of the United States Congress. The reason I would not vote in favor of it is because it's going to cost too much and it's not going to fix our problems in healthcare. Now, I do believe that President Obama has gotten the diagnosis correct. We do need some form of healthcare reform in our nation. The problem is that I believe the prescription being offered by the U.S. Congress is all wrong for the American public. What I believe that we need, and I believe that the current healthcare reform bill is not addressing, is number one, real medical malpractice tort reform. Tort costs are unfortunately one of the fastest rising costs in the provision of medical care in America today. We need to control medical malpractice tort costs. Second, we need to allow for the interstate sale of health insurance in our nation. Here in the state of Hawaii, 90% of all Hawaii residents get their health insurance from only 2 companies. That's not real competition. That's not addressing the problem. Third, this is perhaps the most of all I think we need, is the bold reform changing our tax code. Instead of having health care provided by corporations with a corporate deduction, we need to allow an individual deduction for health care insurance. Health insurance should be owned by the individual, not by your employer. If you don't ask your employer who you get your life insurance, your home insurance, your auto insurance from, you shouldn't need to ask your boss who you get your health insurance from. These are the forms that we need. These are the forms that will fix it without spending $1 billion.
Thank you. Charles, answer again.
Hello, thank you very much. I have worked in the humanitarian field for over 30 years on the local, national, and international level. Also in the area of health, I also have been educated at the University of California Medical Center in San Francisco, and also I'm in the health field today, providing health care. We know some of the things that Dr. Shintani does. He sees that it's important for us to go to the causes of some of our health problems, and not just the symptoms. And using these pharmaceuticals often deal with the symptoms, and it doesn't solve the cause. So therefore, I think this is an important part of the healthcare concerns that we need. I'm for supporting the healthcare reform, but we can see if you want to bring change, it's a big challenge. Einstein said, doing the same thing and expecting something different is insanity. So it's incumbent upon us to help in this matter of change. Healthcare involves not just healthcare, but we spend such a tremendous amount of money for our wars in other countries. That's why I feel it's important to take advantage right now during the interim period to advance peace in Israel and the Middle East. I'm educated in that area, and I propose to do so. I promise that we will have advanced peace in the Middle East. The Hawaiian problem, I'll do that also, and this also involves areas of health. I will work in order to advance this reform. It's a challenge to have reform. During the New Deal, the same thing happened. And with your support, I ask you to support me. See Kawi Yohanan Amsterdam during the interim period, and not waste time and wait for the interim to go by and then go into the regular period. Thank you very much.
And now we offer our candidates a 1-minute rebuttal for clarification. Ms. Case.
Let me start by saying that I agree with something that everybody said. I agree with myself. I think that when Colleen talked, I think part of the uninsured, she spoke the truth. I think when Charles talked about cost controls, he spoke correctly, and I agree with him that we need health reform, that we need interstate sales of health insurance, and we need some better form of financing. Raphael, I think you were correct on that.
This will not solve in and of itself the problem. I asked Charles directly, how are you going to cover the 30 million Americans? Because I do not believe that a market-based reform system, which is what you advocate, is going to do that job. I do not believe that those will, in and of themselves, control costs. I agree with Raphael, it's competition. We need to open up the competition. This is what we need to do. We need to deal realistically, get away from the parties and stuff, and put it all together into a package that can work for everybody.
Thank you. Gentleman, lead.
I believe there's, we have to have a way to have managed healthcare so that the costs don't spiral out of control. Yet on the other hand, healthcare needs to be readily available, especially to those that need it. I believe that we should have a more emphasis on preventive health, as well as exploring alternative health forms such as acupuncture and Eastern Oriental medicines. As for the public auction, sure, it will spur competition, but I think that we should let the private sector do a chance to provide healthcare and insurance companies, and before we step into public auction, because we have to stick to the core functions of government. Thank you very much.
Thank you. Colleen Hanalusa.
Thank you. First of all, I believe that the one thing we should all agree to is that status quo isn't doing the job, and we shouldn't be stuck on the status quo. We must look for some kind of change. The proposal of the, that's going to reconciliation, we all know must become deficit neutral. That's one of the things that they're looking at. So as far as the future costs of healthcare under this proposal, it will be deficit neutral. Public options, some support it, but we do know that that's probably not going to be part of the reconciliation process as well. However, maybe the Senate's proposal, which is this exchange process, which is their response to public option, may be there to actually assist in this situation. To bring it home to Hawaii, one of the things we must also recognize as part of the whole cost of healthcare is we cannot have unfunded mandates upon us, like Compact and Free Association, where our state has to carry the burden.
Thank you. Rafael Del Castillo.
Thank you. I think we have, and I think it is important for us to tell you how we would vote on the bill that's before Congress. And I would vote in favor of the bill. And the reason for that is because Congress has been promising us health care reform for a generation, and we haven't got it. We passed Medicare a couple of generations ago, and Congress has repeatedly amended Medicare to tune that legislation to make sure that Medicare works well for the people that it covers. Unfortunately, Medicare is going to run out of money. But to move on to a couple other points, I disagree with Charles on interstate sales. We need to regulate insurances sold in Hawaii. We do have foreign insurers selling healthcare insurance in Hawaii, like Aetna and other companies. And I also disagree on the tort reform because we wind up financing the losses in tort reform in Medicaid and sometimes even in Medicare.
Thank you. Charles, Djou.
You know, Wayne, for your audience, I believe, certainly, if I'm fortunate enough to be elected to the United States Congress, I cannot promise you that I will agree with you on every single one of your positions. What I can promise you is that if you ask me a straight question, you ask me what my position is on a particular matter, I will give you a straight answer. Raphael, I want to compliment you that you gave a straight answer. While I disagree with you, you took the issue straight on. I invite all of your listeners to ask yourselves, after listening to all the responses here on this healthcare matter, on the bill in front of the United States Congress right now, in front of the U.S. House, do you have a clear understanding whether or not each of these candidates would vote in favor or against that measure? I clearly articulated I oppose this measure because I believe it insufficiently addresses the issue of medical malpractice tort reform, does not address interstate sale of health insurance, and does not reform the tax code in a manner that will lower costs and spread health care insurance throughout our nation. Thank you.
Thank you. Charles Amsterdam.
Again, remember, it's Kau Yochanan, Amsterdam. I